Here's an interesting fact for everyone. Did you know that cold weather is the most common health risk that you're going to run into this winter? You might have thought it was COVID, but I got news for you. It's the cold weather. And then we're going to talk about shoveling snow. If snow wasn't already a four-letter word for you, it might be after today's show. Stay tuned. Well, good morning, everyone, and welcome to Scan FYI. I think we have a very interesting show for you today. My guest today is a cardiologist, Dr. Julie Master. Hi, doctor, and thanks for being with me. You know what? Why don't you introduce yourself? Tell us a little bit about you, where you work, and what is your main focus?
Of course. My name is Dr. Julie Master. I'm a non-invasive cardiologist. I'm part of Monmouth Heart Specialists, which is a group for Robert Wood Barnabas Health. From the hospital standpoint, I'm out of Monmouth Medical Center, where I'm a director of non-invasive services. And our main practice is in Eatontown in New Jersey.
Well, thank you for being with me today. And, as we kind of hinted to, we ought to talk about the cold weather. And it does, I think you should learn something new every day. And today what I learned is, I read your notes today and I learned a lot. And I was honestly very surprised about some of this. So I'm really glad that we're going to talk about this. So why is the cold weather the most common health hazard that many people will face?
Well, there's a lot of factors that happen or affect our heart.
Our hearts. We're talking about our hearts.
In the winter, yeah. When it's cold, your body needs to warm you up. So your heart needs to pump a little bit harder, and your blood needs to flow a little bit faster. So that already puts the strain on your heart. Also, the arteries, your blood vessels, they don't want to lose the warmth through, and they constrict. So pretty much they squeeze. And that happens in your arteries in your skin, as well as in your body. So that can raise your blood pressure just by doing so. But our heart also has its own circulation. It has coronary arteries, which are the arteries that run on the surface of the heart. And those arteries can also constrict in the cold weather. And that sometimes can give you certain symptoms of angina or chest pain. And sometimes with extremes of exertion, it can cause a heart attack as well. So in the winter, we see a rise in heart attacks and a lot of other symptoms as well.
Now, so I didn't realize that in the winter, there are more heart attacks that people, and this is directly due to the cold.
It's associated. I think
associated.
We also do certain things in the winter that may not be healthy. We may hunker down and kind of not be as active. We may indulge during Thanksgiving, Christmas, and our blood pressure may be higher, our cholesterol levels may spike. We may be so worried about getting those Christmas presents and then being around all the family members, all the drama that is associated with that of course can raise your blood pressure, can spike your cortisol levels. And of course, certain other things that, if we are sedentary, we're not moving, not going for a walk, and, a lot of people not doing things that they did before, like they're not going to the gym maybe now because of the fear of coronavirus infection, maybe just staying at home, and then, they have to go out and exert themselves doing certain things suddenly after they haven't been active, and that can put you at risk.
And of course, in the warmer weather, lots of people are out and about, whether they're gardening or going for long walks and hiking. And in this very, very cold weather, we're just not doing that, are we? We're probably staying in the house. So then it snows. And listen, I'm not a lover of snow. I'll say that right now. But snow presents some very interesting problems. And I'm going to read something that you sent me, Dr. Master, because again, I learned a lot today. Why is shoveling snow a high-risk activity? Shoveling snow is a strenuous activity that is compared to running on a treadmill at full speed. In a million years, I would have never thought that.
It is very difficult.
And let me just say that even someone who's very fit is not always capable of running on a treadmill at full speed.
Absolutely. And, we also, when we tend to shovel, we shovel early. And, of course, morning hours are very well known to be, higher time for heart attacks because of the, cortisol that's excreted. So a lot of heart attacks happen in the morning hours. And we, go and take that shovel that may be too big for us and try to pile as much snow so we get done
quickly.
And then we are already stressed out because maybe the spouse or somebody needs to go to work and we need to shovel them out as soon as we can. And then we may have like a nice hot cup of coffee that will spike our blood pressure and may not be a good idea. And maybe may or may not have a heavy breakfast, maybe dress too little or maybe too warm. Because when if you, let's say you overdress, you get hot, your blood vessel dilate, your blood pressure may fall, then you get dizzy. And if you don't dress too warm enough, then you may get too cold and your blood vessels will constrict and you may, have worse symptoms because of that. So there's kind of a fine balance. But yes, shoveling snow is pretty stressful physical activity for a lot of people, and probably even more strenuous than regular stress tests that we do on patients, because during the stress test we will slowly, gradually speed the treadmill up every 3 minutes. We won't just get you started running, which is what happens when you shovel.
Right. You're full speed ahead. There's no warm up.
Absolutely. But we can warm up.
So, and I can imagine too, I mean, I've been in this situation too, it's 8 o'clock in the morning, it's snowing, you have to go to work. You're stressed, you're bundled up for work. Maybe you're overdressed, maybe you're not dressed well enough. And it's just not a good situation, no matter what. But what can you do to say lower your risk? If you do have to shovel snow, which I think the best thing to do is call a teenager. That's what I would do. But if that's not feasible, what might you do to lower your risk?
I mean, patients often ask me, actually, am I good enough to shovel? So there's certain patients that should not shovel at all. It may be too much for them to do that kind of exertion. And in those cases, yes, I think they need help and they need somebody to come and do that for them. If you have no choice but to shovel, first of all, you want to try maybe wait a little bit until the sun warms it up. You want to stretch out, warm up yourself, do some maybe walking around the house, stretching a little bit, not having a very heavy breakfast, because if you eat too much, the blood is kind of shunted to your gut and your body tries to metabolize the food, and then it also needs it for the heart. And then you want to make sure you don't have too much coffee, because even though it gives you a boost of energy, it also raises your blood pressure. And when we exert ourselves, our blood pressure goes up much higher. So we don't want to, shear that plaque off our arteries. If then trying to dress up in layers where if you start feeling warm, you peel off the layer. and trying to maybe take a smaller shovel because you're lifting,
Smaller
even
shovel.
though you may, the snow tends to get wet and gets heavy, and the big shovel is, a lot of lifting. So smaller shovel, and take it small intervals at the time, maybe 15 minutes or 10 minutes, and not, very vigorous speed. Don't set yourself a goal. I'm going to clean the whole driveway. Just clean
10
enough
minutes.
for you to get to mailbox or just get your car out, but not, don't be a perfectionist.
Well, you know what,
Listen to your body.
Dr.
Yeah.
Master, before you were saying something about there are certain people that absolutely should not be shoveling snow. So who should not shovel snow?
Well, and of course, if you see a heart doctor, if you have a cardiologist, if you had a heart attack, if you had a stroke, if your blood pressure is not well controlled, you can ask your doctor towards, like a lot of my patients do. They ask me ahead of time, is that okay for me to shovel? And the family members ask, is okay if it snows, should I be shoveling? And some patients, I say, no, it's not okay for you to shovel because, it's too much. It may be too much for some patients, to do that.
All right. Well, I like the idea of a smaller shovel because obviously snow shovels tend to be pretty huge, right?
Right.
So that is something that you can do right there. And I thought that was also interesting, just to follow up with that. You should, after you shovel a little bit and then you come in the house, you should not be drinking anything caffeinated.
Well, you try not to. You can have warm tea or decaffeinated tea. I mean, you just try not to raise your blood pressure too much with having very strong coffee. Because
okay.
It's not about just the caffeine, it's more about your reaction to caffeine. So where in some cases, if you have your usual cup of coffee every day and your blood pressure is fine with that, I'm not going to tell you not to drink the coffee before shoveling because you do well. And we know that people who drink the same amount of caffeine every day, they may be fine with that cup of coffee. Don't give yourself, don't have a Red Bull if you never have a Red Bull.
Right. This would not be the time to try a Red Bull. Absolutely not.
Yes,
so let's say you're out there and you're shoveling and now you're not feeling well. What do we need to look out for? What are those warning signs that you've overdone it?
So first of all, stop. If you're not feeling well, don't say, oh, I have another 2 feet to go. You try to stop and then you walk into the house, make sure you let your loved one know that you're not feeling well, not that you stay by yourself in the basement and see if it goes away. Right. Then you relax, take your clothes off, see if it passes or whatever you feel. So, the traditional, angina or cardiac chest pain in the male would be pressure, something sitting on my chest, it's hard to breathe. So that's a traditional symptom. Patients with diabetes, women, get different symptoms. Sometimes it's not going to be pressure in your chest. Sometimes it's going to be just, it's hard to breathe, or you get nauseous and you feel like you're going to vomit, or you feel sweaty, lightheaded. So all of those symptoms can be a sign of something going wrong, of a heart attack. And, something that, let's say you have some pressure in your chest and then you stop shoveling and it goes away, great. But, then you shouldn't go back to shovel. Then that exertion for you is not good.
It was too much.
Right. But if it doesn't go away after 15 minutes, it doesn't go away, you should call 911 and get yourself to the hospital. Because, time is very important. If somebody's having symptoms and they let the time pass, they may be missing the chance for us to open the artery and save, as much as heart muscle as possible. Because the cold weather, not just what we discussed, it can also, some hormonal changes can cause more clot formation. So, combination of squeezing blood vessels together with sticky blood cells, can lead to a clot. being, whether it's a stroke or a heart attack, and of course, everybody hopefully knows the signs of a stroke, which would be more neurologic, but those should not be ignored as well.
So snow, everybody, not good. Stay out of it. But now here's a thought I'm wondering now. All right, we're talking about shoveling snow. What if you have a snow blower? Are you okay with that? Does that take the risk away?
Depends on the snow blower. there are, of course, snow blower can be much easier. My husband complains now our snow blower is not big enough and he needs to shovel anyway. So, and depends what you need to do with the snowblower. Do you need to push it hard? It may be as hard as pushing a shovel, if not harder. Do you need to? So it's all about the amount of exertion. And is it something that you do usually? Like if you mow your lawn every summer and then you push the snowblower, maybe it's similar exertion for you. But if something that's different, something that you tell yourself, oh my, and I don't do that often, and this is going to be difficult, it has to be something that you listen to your body responding to it and see, and take some precautions.
So I think, well, you just said a mouthful there. Listen to your body. If something is hurting you, not a good sign. And if you're feeling any kind of discomfort, maybe shoveling snow is not for you. Again, call that teenager. Keep that number on your refrigerator. But now winter, there's other things we have to watch out for in the winter for our heart health. And maybe Dr. Master, you could just talk a little bit about that.
Well, I think especially now, we want to make sure we get our flu shot because, heart attacks, a lot of coronary disease is connected to inflammation, and plaque rupture is connected to inflammation. And one way to lower your risk of a heart attack is not to get a flu. So getting your flu shot and now getting your booster if you didn't get COVID booster yet, because just that, avoiding getting sick will lower your risk of having a heart attack during the winter, and making sure that all your prescriptions are up to date, that you're not on your last pill of blood pressure medication with your storm coming in 2 days. You might want to go earlier, and I'm sure your friendly pharmacist, you don't have to go on a day when you take your last pill. You should try to get it earlier, because if you get stuck at home and then you're going to just shovel because you have to get to the pharmacy, and a lot of pharmacies deliver at this point. So you might want to just make sure you're up to date on your medicines. Make sure that maybe let certain things slide, like try not to get too stressed out about, somebody saying something at the holiday party. And, of course, having a, stiff drink before you go outside and shovel, that's not a good idea either. So alcohol, of course, can contribute. And, the way you are ready for physical exertion, if you try to do a little bit every day, so try to walk every day. All you need to do is, just a little bit of exertion.
Yeah.
Of course, we're aiming for half an hour walking most of the days, but, staying active, will leave you in a better shape for times like this, for times of stress when you need to, exert yourself. And, making sure your blood pressure, your cholesterol levels, that you have your regular checkups, that you're up to date on your medicines. I think that's what will keep you, feeling well during the winter, and, leave it uneventful for you.
Yeah, hopefully uneventful. And, my 2 cents is if it's snowing and you don't have to go anywhere, really, why do you even have to? Don't even worry about the snow or shoveling it. Mother Nature, maybe tomorrow the sun will come out and everything will be melted. And, if you don't have to go anywhere, and especially, Dr. Master, like you're saying, if you've got your medication, you've got what you need in the house, that just takes away all the stress. You don't have to be anywhere.
Right. And, most of us should plan for, if it snows,
right, a weather emergency,
Like you should plan like the way you plan for your appointments and refills. You can plan for things like this. If you don't need to go out, and your grandson cannot come until 2 p.m., that's all right. Let him bring in your mail and, shovel you out at that time, not do it yourself in the morning.
You know what I'm imagining? In the summertime for the kids, they have the little pails and shovels. I'm imagining a run on all those little shovels. Don't shovel anything bigger than that, and you'll probably be okay.
Yes, right. Hopefully.
All right. Well, I hope that you found this really enlightening and that you will really be super duper careful in this cold weather. It's not just COVID we have to worry about. We have to take care of our hearts. And who knew that shoveling snow and cold weather could be so detrimental? So everyone, this is the year to take good care of yourself. So Dr. Master, I really appreciate you being with me today and educating our audience.
It's my pleasure.
All right. Remember, everyone, if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI. Bye, everyone. Bye, Dr. Master.
Thank you.